Guys, focus of this discussion is fidelity, one of the basic ethical principles that you need to remember. So let's look at fidelity. When we say fidelity, it's basically keeping of promises. Now, being true to one's word, they usually say, and remaining faithful. Take note of that for those there na mga hindi faithful, remaining faithful to the professional promises made to provide quality, competent care to our patients. Well, that is how it is defined in nursing. No? But in general life, no, so if I'm talking about fidelity, it's about being faithful. Okay, it's about being faithful. So I hope that you'll remember that. Fidelity is about keeping promises and being faithful. Now, when I talk about fidelity, it is an obligation to act in good faith and keep your vows and promises, to fulfill agreement and maintain relationship and fiduciary responsibilities. So kung titingnan nyo guys, no, the big word there that you need to write maybe if you're writing down is obligation. Okay? Meaning class, when I talk about fidelity, fidelity is also about fulfilling your obligation. Meaning, if you told your patient, sir, I will be back, okay? I will be back by 2 p.m. You need to be back by 2 p.m. Pag hindi ka nakabalik ng 2 p.m. dahil may emergency ka sa kabilang patients, you should inform your patient. For example, 2:30 ka nang nag-arrive. Sabihan mong pasyente, sir, sorry, I understand that we talked that we should be there by 2. However, I was not able to because I need to attend to some emergencies. Why, class? The main thing that fidelity is developing is actually trust and confidence. The main thing, class, that fidelity is developing is trust and confidence. If you are dealing with a patient, the patient will be trusting you if you are true to your own words. Okay, class? The patient will be trusting you if you are true to your own words. So pag magkaganon, guys, no? So dapat, kung anong sinabi mo kay patient, dapat gawin mo talaga. Pag hindi mo magawa, mag-explain ka sa pasyente. Okay? Because it leads to trust and confidence. Now, it is a contract of relationship that we enter also with our patient. So being faithful is not just about being faithful with your relationship, it's also being faithful with your patient. Okay? Ngayon, baka iniisip nyo, okay sir, may ibig sabihin may relationship kami ng pasyente. Yes, you have a relationship, you have a trusting relationship, but that's a professional relationship. Okay? Take note professional relationship. It's not wise for a nurse to fall in love with a patient. Okay? Baka mamaya kung ano-anong relationship ang pumapasok sa mga isip nyo. Baka mamaya in love ka sa patient mo, no? Tapos mamaya yung patient mo pa-cute-cute din sa'yo. Okay? It's difficult to go into a relationship with your patient. That's why when you're having that relationship, you keep it professional. Okay? That relationship should be kept professional. Now, on the side, if the patient will be asking for your mobile number, will you give your mobile number to your patient? Bibigay ko ba yung mobile number? Isip ng iba. Depende.
Depende, sir.
Depende,
sir.
Pag mukhang maganda or gwapo, why not? Ay, nako. Out kayong lahat sa meeting room. Bawal maging nurses itong mga bastos. Okay? So, guys, take note that the general rule is that you should not be giving your contact numbers to your patients. Okay? That's what we meant by keeping your relationship at the professional level. Because once you cross the line, it's already difficult. Okay? Especially if you're dealing with your psychiatric patients. Especially class if you're dealing with patients with mental health problems. Okay? Now, the next thing there is that fidelity is based on the model that you keep one's word, okay, loyalty to commitments and oath, and then being reliable. So class, reliability is about consistency. Okay? So if you know, if your patient expects that every 8 a.m. you will be there, you should be there every 8 a.m. When the patient expects that at around 8 a.m. we are doing our rounds, every 8 a.m. you should be doing the round. Because that is being reliable. Okay? Ayaw nating pakinggan, for example, that the patient will say, bakit si Nurse Grace everyday nagra-rounds? Pero kung si Nurse Gilbert yung duty, parang walang rounds na nagaganap. That's not being reliable as a nurse. Now, in common Spanish terms that we Filipinos are familiar with, we use the term palabra de honor. Diba? You should have your word of honor. Then you value loyalty and trust as well as standing true to one's own word. Halimbawa, If you told the patient that, sir, anytime that you will divulge the information, sir, anything that you will be telling me, everything that you will be telling me, hindi ko po sasabihin sa iba. You need to be true to that. You need to be true to that. Unless if, for example, the patient said, nurse, parang gusto ko nang mamatay. Okay? When the patient says that he is suicidal, can we keep that information or do we need to inform others?
Need niya inform, sir.
So need mo lang i-inform ang others. Need mo lang inform ang others. What's the purpose? Para kung multuhin kayo guys, sabay-sabay kayong multuhin. Okay, kidding aside kidding aside. So what's the purpose guys? There's already threat to life of the patient. There's already threat to the life of the patient. Pero take note, standing true to one's word. Sabi mo kay pasyente, you will not inform others. But here comes this time, sabi ni patient, I want to die now. And you need to inform others. What will you tell the patient? Sir, I am sorry, but this information needs to be communicated to other members of the team. Okay? So dapat inform mo rin siya. Okay? Or else class your patient feel that you have betrayed him or her. And the next time he will not trust you already. Okay? Now class, why is that our patient is saying that? That is actually their way of saying help. That is their way of saying they're asking for help. Okay? Pag kayo if ever that will happen to you again, for example, that will happen to you that somebody is talking to you like they want to commit suicide. Okay, dear students, you are not yet equipped to handle this situation. Okay, your training is not yet equipped. Your training is not yet full towards handling this situation. Sir, anong gagawin ninyo? Okay, if there's somebody who said na, hey, I want to commit suicide, try to talk to that person while you are asking for help. Okay? Continue mo lang, talk lang to that person through phone. Halimbawa, best friend mo siya. Okay? Talk to that person through phone. Allow that person to vent out feelings and then seek for help. Okay, what do you mean by seek for help? Try to reach out the family members. Try to reach out also the loved ones. Okay? And then try to inform them that this patient is planning to commit suicide. Okay? Kadalasan guys, ano lang yan? Kwentuhan lang yan. Okay? If ayaw pa rin, you can search for mental health programs of the DOH. The Department of Health has Mental Health Connect, which can be found even in Facebook. You can chat there if you have problems. Kayo din guys okay, along the way, baka sabihin nyo si sir nagjo-joke lang ng suicide. I don't mean to do it Okay, suicide is not a joke. Okay? Threat for suicide is also not a joke. So if ever you feel something like that, okay, you try to connect with experts. You try to connect with experts. Don't worry, hindi naman siya magandang dahilan, pero you're not the only one going through like that. Okay? Many people are actually going through the same. So before it's too late, you ask for professional help. Okay? Now, it also encompasses the traits of maturity and commitment. Ibig sabihin, guys, when you value fidelity, you act to be a mature individual and committed individual. Okay? Hindi ikaw yung tipo ng individual na, uy, sige, magpa-promise ako kasi may kailangan ako kay patient. Uy, sige, I will say this word to comfort my patient. No. Okay? A mature individual would be able to handle these situations, and that is your fidelity. Okay? And then when you say to your patient that, sir, I will be giving your medications. Or halimbawa, sinasabi, kadalasan ganito sa hospital, pupunta yung folks, pupunta yung mga kasamaan ng pasyente sa nurse's station. Tapos magdadaldal. Magpa-follow up. Palagi na lang follow up. Tapos ang nurse, alam mo nung sinasabi, sige ma'am, kaming bahala. Tapos pag-alis ng mga folks, pag-alis ng mga kasamahan, kadalasan sabi ng nurse, ang kulit, hayaan mo na nga yan, ang kulit. Okay? So what would you do? You need to stay loyal to your words. If ever you said that you will follow up, commit to that word. Or else, guys, you are not following the principle of fidelity. Okay? Which is very important. Next, what's the importance of fidelity in nursing ethics? Guys, fidelity is actually considered to be the most important because it governs the other six. Example of the other six that we are referring to is the principle of autonomy. Even class the principle of beneficence. All of these principles could not stand without fidelity. Kaya halimbawa, autonomy. Di ba autonomy is acting on behalf of the patient, no? Or autonomy is allowing the patient to decide for him or herself. The right to self-determination. Guys, autonomy could not be practiced, no, without fidelity. Okay? Autonomy could not be practiced without fidelity. And then nurses promise to provide competent care to patients. And in what way do we do that? That care should be honest, responsible, and fair. Okay? Pag sinabi nating responsible, halimbawa, your duty is 8 a.m. to 4 p.m. That's the usual 8-hour shift. No? Other hospitals would have it at 7 a.m. to 3 p.m. Pag ganun yung duty mo, you need to ensure that within this time, your patient is properly taken care. Okay? Now, what's the sad reality that is happening in the hospital? When nurses are on duty at 8 a.m. to 4 p.m., there are nurses who would just come in the hospital at 8 a.m. They would see their patient once at around 9 a.m. Tapos uuwi lamang ng 4 p.m. Hindi na ulit nakita ang pasyente. Okay? I have noticed this several times in the hospital. What is the reason? No? May mga valid reasons din naman. Iba kasi class too busy talaga. There's just too much workload. That's why they could not handle the responsibility. But undeniably, there are still others who are too focused on social media distraction. Okay? Napakaraming nurses, walang time para sa patient pero nagsa-cellphone. Okay? Maraming ganon. So as a nurse, if you are dealing with your patients, you need to take note that these patients should be taken care of during your course of duty. Dapat ang way is honest, responsible, and fair. So hindi siya pwede na sabihin mo na, oy, 8 lang naman yung duty ko, isang beses ko lang yan pupuntahan. Pag sinabi din nating fair, hindi pwede dahil maganda yung pasyente sa room 201, doon ka na lang palagi bumabalik. Dahil malamig yung aircon sa room 202, doon ka na lang bumabalik. Kasi nagbibigay ng pera ang room 203, doon ka rin nagbabalik. Hindi pwede. When I say fair, kahit maldita man yung sa room 204, you treat them equally and with justice. You treat them equally with justice. So dapat fair ka rin in dealing with your patients. Okay? Malalaman nyo yan later on pag nag-duty kayo, no? Yung feeling mo minsan, ay, suplada yan, maldita yan sa room 204. Huwag mo nang puntahan. Okay? Please don't be like that. Ha? When you are dealing with these patients in the clinical setting, just think like this. That these patients, guys, who are irritable, does not actually have a problem with you. Okay? Hindi ikaw ang problema nila. Sir, sinong problema nila? They actually have a problem within them. Okay? Hindi kasi nila kayang ilabas yung problem nila. Or they feel uncomfortable with their disease process in such a way that they think na parang invalid na sila. In such a way that they think na parang wala silang silbi. And for that reason, my dear students, they become irritable. Okay? So for example, no, may isang pasyente, sisigawan ka. Okay? Halimbawa, sisigaw, lady, I hate you. Or sasabihin sa'yo, Cheryl, ayaw ko na itong pinaggagawa mo. Nakakainis kang uri ng nurse, wala kang silbo. Okay? Admittedly, guys, medyo masakit yan. Ha? Admittedly, medyo masakit yan. But please do not take it personally to your patients. Okay? They are just irritable because they are also going through something. Okay? Kindly take note of that. Now, what are the common conflicting points? Bakit mahirap i-apply ang fidelity sa area? Okay? 1, there is in conflict on what we believe is right, what the patient wants, what other members of the healthcare team expect, and what is required by policy and law. Okay? In other words, iba din ang gusto ko, iba ang gusto ni patient, iba ang gusto ng ibang healthcare provider, iba din ang gusto ng policy natin. So, as a nurse, you need to balance these 4. Your own point of view, that of the patient, that of the other healthcare providers, and that of the hospital policy. Okay? Now, if I will ask you, to whom should you remain faithful among the 4?
Patient.
Okay? Yes, patient. Patient. No? Patient. It's very easy to answer that right now since you are still students. No? But by the time, or kung naka-experience na kayo, wherein ang gusto ng patient iba, pero ang gusto mo iba, mahirap. Okay? Much worse kapag iba yung gusto ng patient, pero iba din yung gusto ng mga healthcare providers. It's difficult for us to do it. Okay? But as what you have answered, you need to stick to the fact that your focus of attention should be the patient. If there is fidelity here, fidelity should be applied to our patients because our loyalty lies to our patients. Okay? But take note, halimbawa yung patient mo, psychiatric. Okay? Halimbawa itong pasyente mo, merong mga psychotic na mga manifestations. Halimbawa, baliw siya. Or halimbawa, gusto niyang saksakin ang sarili niya. When I say that we prioritize the patient, it does not mean na kapag gusto ng patient na saksakin ang sarili niya, you would just allow the patient to do it. It is part of your responsibility as a nurse to protect the patient from any harm. May that harm be coming from himself or herself also. Okay? Kindly take note of that. Then, you also need to remember that fidelity among patients with an appropriate behavior is also one thing that. Okay? Now, take note basahin nyo. Fidelity among patients with inappropriate behavior. Now, what do we mean by that? No? What do we mean by fidelity among patients with an appropriate behavior? Pag sinabi nating inappropriate behavior, halimbawa, this patient of yours na bastos, this patient of yours who will be shouting, this patient of yours na hinipuan ka, case the patient who touched you, for example, without your permission. Now, for this case, guys, this is not always easy. It's not always easy, no? So, kung experienced nurse ka na, madali lang sabihin na, okay, ignore yan. Tulad ng sinabi ko kanina, di ba? Sabi ko sa inyo, if your patient becomes bastos, ignore. Okay? It's very easier said than done. It's very easier said than done. Now, if you would look at it, it says there that, okay, bakit ayaw nang sumunod? Okay? It says that you need to put aside any negative feelings. Look at the word, put aside any negative feelings and adhere to the standard of care. Halimbawa, if your patient is the ex of your boyfriend, or let's say, for example, para mas malala yung example, your patient is the one who stole your boyfriend from you. Okay, halimbawa, your patient is the one who stole your boyfriend from you. Guys, you don't have a choice. You need to take care of her. Okay? Kahit ano pa yung history ninyo, you need to take care of her because it is part of your responsibility as a nurse to take care of her. But, pag hindi talaga kaya, pag feeling mo, parang gusto mo talagang siyang sabunutan at saka patayin, no? Kay bilang pasyente, kasi gigil na gigil ka sa kanya, what would you do, guys? What would you do? Stay taking care of that patient, or can you request to be transferred to another patient?
Request to be transferred.
Request, sir.
So you can
Transfer
request to be transferred to another patient. Okay? Request to be transferred to another patient. If you have feelings like this, try to talk with your team members if the feelings toward the patient could compromise already. Okay? Halimbawa, sabihin mo sa mga kasama mo, fellow nurses, I feel inconfident. I feel fearful if I will enter the patient's room because this patient is very abusive. Okay? I don't want to stay with this patient. If that's the case, guys, you're free to talk out. Okay? But take note, okay? You need to train yourself to put aside negative feelings. Okay? Particular example, I have encountered patients na sinisigawan ako, guys. Okay? Day 1 admission, sisigawan ka. Pagkatapos, if you'll just set aside your negative feelings, alam mo na yung unang pumapasok. What's the first thing that would come into my mind? Parang sinasabi ko, patient, I'm also tired. Okay? Huwag kang kakasigaw dyan. Kasi kung pagod ka, pagod din ako. Parang ganun yung pumapasok sa isip mo. But you never say that out to your patients. Okay? You know, what do I think of? I just think na it's okay. He's just irritable because he is also sick. You know what? These patients would turn out to love you. These patients would turn out to like you after several days then of being consistent on the care that they deliver. Okay? So I hope that you will be able to practice that value of fidelity while you're taking care of your patient. Okay, any questions in mind?